Why we bulge disc is usually because there's a lack of movement in the vertebra. Today I'm going to explain how we can prevent that. Now, in previous video, I always talked about when there is a lack of movement in the vertebra that either lead to degeneration or bulging disc. In younger people goes to bulge disc, and older people goes to complete degeneration. And let me show you a model here. This is representation plastic model of the healthy disc. The height are intact, the bone height, the disc height are intact, and as you can see, there is no pressure on the nerves. The bones are completely intact. Now the muscle we are talking about, they going from this bone to this bone, or skip one and go to next one. That's how we have smooth rotation and smooth bending. We don't bend like robots, or going from this. This is called spinous processes. This is called transverse process. Now let me show you a completely degenerated spine. Look at what is the height difference. The height difference multiplied by 7 in the neck, 12 in the upper back and mid back, and 5 in the low back. Do the math. You will see that's when the older people, they say they lost their height. This is why. Now in this video, we're going to show you how to prevent this degeneration or bulge disc. Let me show you a bulge disc. This is the bulge disc. The very first center goes first, and that's where he puts the pressure on the nerve. Now, in younger people, is most likely is going to be bulge disc or protrusion. Older people, degeneration or complete destruction of the disc. The reason this video is about to prevent that. The major reason is why the vertebra does not move. If you see on this model of the spine, the very first thing that he put vertebra into fixation is the muscle spasm that happens at the very, how should I call it, macro level, in the small places in the joint. You see there are muscle that go from this bone, we call spinous process to spinous process, and from transverse to transverse process. This bone here is called transverse process. Now, sometimes the muscle skip on transverse process and go to the next one. That's why we have such a smooth movement. Otherwise, we would move like robots. Here's another illustration to see where are these muscles compared to our low back. And are very tiny. Most of the time, we don't even feel they are there, but they're responsible with their very small movement. What happened in this muscle, they go to spasm. Usually you don't even feel pain. You will feel pain when this lactic acid buildup touches the nerve. Sometimes months, sometimes years goes by before you realize you have a spasm down there. Sometimes it will take a bulge disc to get you realize that this thing needs to open. So the goal of chiropractic is to introduce motion where there is no motion before. So I hope this video, it was a good explanation to tell you why this spasm happened. That's why when we prescribe you exercises to stretching, we prescribe you to stretch large muscle as much as small muscles to be stretched, to create motion. And when the exercise does not do that, with chiropractic adjustment and therapy, we introduce motion in every individual joint. You see this little joint we call facet joint, and the big joint we call the vertebral disc. All of them, they need to be moving in order to prevent degeneration and a spinal bulging or protrusion.